Hi, it's Congressman Jamie Raskin with our second installment of our new series called Local Heroes. And you're not going to believe the story I'm about to tell you. And it is such a thrill to get to meet, under these circumstances, Dr. Daniel Aukerman. And Dr. Aukerman is a native of Westminster, Maryland, in the heart of Carroll County, which is a significant part of my congressional district. And he is a doctor with Access Carroll, the medical director there, where he has specialized in family medicine and addiction medicine. He and his wife are proud Carroll County residents, and they have two kids. He was approached by well, I'll let him tell you the story of exactly how it happened, but he was approached by Carroll County when the Pleasant View nursing home crisis first erupted. And I think the initial reports were that there were 66 residents of this nursing home out of more than 100. Turned out to be more than 80. I think it was 81 who were infected with COVID. So Dr. Aukerman was asked whether he would be willing to go in. The existing medical director at the Pleasant View living facility was either not able or not willing to come in to this situation of pervasive infection of the residents who are senior citizens in sort of different states of health, even prior to the epidemic. And they approached him about going in. And he had a conversation with his wife and with his family. I'll let him tell you the story. And he decided to do it. And he spent a week there tending to the health needs of the people who live at Pleasant View. So let me introduce Dr. Aukerman, and to tell us, if you would, what was the conversation like with your wife, and who exactly approached you? How did you make the decision to go in?
Yeah, thank you. Ed Singh, our local head of our health department, he called me up in the morning and on Monday morning and a week ago and said, I have a very big ask of you. I'm not going to force you to do this, but we have a situation. We have people that are very sick and are in need, and we have this outbreak. And the medical director is not able to be in there. And would you be willing to go? So, of course, then at first I was quite scared about going, because you hear about people dying, you kind of calculate your own risk. I kind of figure out I'm 53, I risk about 1 in 50 by what I've got from information, and then you kind of talk with the family. You also realize that that's going to, in part of that conversation, kind of think about that it's going to have some implications for me having some time at a hotel afterwards, after the stints there. And also, just not really knowing what I was getting myself into. So, but then I said, okay, yep, I'm willing to go. So it entailed then, yeah, I used to have a beard, so a beard got shaved off, and I had to go in and get the little fit testing for the mask, to get the right sided mask and get lots of papers and everything done. So I spent most of Monday just preparing to then go in on the next day, on the Tuesday.
So you ended up taking over the whole medical operation, and you were with both some patients whose condition was a mild to moderate case of COVID-19, but also people who were more serious but had do not resuscitate orders. Did you have a staff? Were there nurses working with you? Were there any other doctors there?
Yeah, so the way things unfolded, there had been a nurse practitioner who had been out on the Saturday prior and was there for 14 hours and sent some people out and got things kind of started in terms of oxygen concentrators and so forth. And then on that Monday, when things were really getting worse, then the National Guard had a team that came in. And they did a lot of kind of triaging. So the patients that had full CPR orders and needed to actually get transported to the hospital, and they got transported to different places around, some to Carroll, some to Frederick, some to Sinai, to different community hospitals. A lot of that triage was done by the time I came in on the Monday. They did that on Monday, late into the night. I mean, kudos to the staff. You know, they were apparently there till 3 o'clock in the morning, still sending people out, making copies of the charts in a really difficult situation. And, you know, you have to think that, you know, nursing homes are really not designed to operate as hospitals. They're not designed to have this many people get this sick this fast. So there were really people that were working hard and stayed, you know, basically have to live there the whole stretch of time.
All right. Well, Dr. Aukerman, I want to ask you this before we go, and I thank you for joining us. I know you're holed up in a hotel for 2 weeks to see that you get through this, and our thoughts, our prayers are with you all the way, of course. But you've had time to think about it. You've had time to talk to your wife and your 2 kids, ages 11 and 13, and other family about it. Are you glad that you went in to do this, and would you do it again if called upon in this terrible crisis?
I don't think anyone's really excited about going and doing this work, but it's necessary work. It's work that you're trained to do. And so if the need arises, I would be willing to go do something similar again. Yeah, so that it would be more dependent on the need and the situation. But if there's believable human suffering and you're able to do something to relieve that suffering, then as a doctor or a healthcare provider, it's your duty to try to step forward as best you can and do that work.
Well, I know you went to med school at the University of New Mexico. I'm just really glad that you came back to Carroll County, Maryland, and that we've got you here. You are a local hero to everybody in Maryland's 8th District and across the state of Maryland. Hang tough and Godspeed in your journey.
Yep. Everyone has their job to do in this pandemic, and distancing is the most important thing so that you see less of what I needed to see there at Pleasant View. Thank you.
All best to you.
All the best to you as well.
Perfect.